Hi everyone, welcome to researchmd.com. Another great presentation. All of our presentation again, 9-minute review, my friends. Everything you need to know under 9 minutes. So make sure you need to repeatedly watching so it stays in our memory for a long time. That's the only way to do it. There's no point in watching another 1 hour long video and then you don't have time to watch it. So we making sure all our presentation under 9 minutes. That's a hallmark of our presentations. Again, my name is Pramil. I'm a program director, internal medicine residency, transitional residency, and I teach medical students and residents. So let's get into our topic, okay? When you talk about splenomegaly, it's good to know what is the size of the spleen, right? You got where does it sit and all that. Ribs 9 through 12, measuring on the level 12 centimeter in the cephalocaudal axis. So remember, 12 centimeter, more than 12 centimeter is splenomegaly, more than 20 centimeter massive splenomegaly. So normal size spleen is usually not palpable in adults, okay? Now, when you talk about the spleen, make sure like you know the function of the spleen. Hematopoiesis, right? Remove old and damaged RBC, opsonize platelets and white blood cells, immunosurveillance, removal of microorganism and antigen, maturation of lymphocytes, and synthesis of immunoglobulin and stores platelets. So big job for spleen, right? And splenomegaly, what are the causes of splenomegaly? You can have like liver diseases like cirrhosis and hepatitis. You can portal hypertension, hepatic vein thrombosis, Budd-Chiari syndrome, and then hematologic malignancies like lymphoma, leukemia, myeloproliferative diseases, right? And then you get immune-mediated destruction of red cells like example ITP, autoimmune hemolytic anemia, Felty syndrome, and all those kind of things can cause it. The other cause can be sickle cell disease, hemolytic anemia, thalassemia, chronic infection like bacterial endocarditis can cause this, infectious pneumonucleosis can cause this, HIV can cause it, malaria, tuberculosis, and even abscess can cause it. Connective tissue disorders, lupus, rheumatoid arthritis, adult onset still disease, and infiltrative disorders we need to know like sarcoidosis, amyloidosis, and glycogen storage diseases. And your focal lesion, hemangioma, abscess, system metastasis can also cause it, right? Let's look at the signs and symptoms usually patient present with. First one is abdominal fullness. They got early satiety, fatigue, weightless, frequent infection, easy bleeding, jaundice, and anemia. Those could be very common, okay? So physical examination, you can see inspection, palpation, descending spleen or the inspiration percussion, Nixon sign, dullness of the percussion in the right lateral decubitus position, midpoint, and the costal margin perpendicular to the left mid-axillary. The likelihood ratio of physical examination is pretty high, around 3.4. You can pick it up. Now, splenomegaly always, but it needs like complete evaluation, right? You need to rule out like a lot of other things. We already talked about so many causes. First, you make sure you do a complete history, detailed history, even travel history you need to ask. Blood test, you get the CBC, peripheral smear, liver function test, inflammatory marker, rheumatological panel, because an infectious disease testing, bone marrow aspiration, biopsy. So you need to do an extensive investigation in the splenomegaly cases. Like imaging, we can do an ultrasound and CT scan. Let's look at the sensitivity and specificity. Ultrasound like 100%, 74%, and then treat the underlying causes, protect the patient from complications of splenomegaly, right? Splenic sequestration crisis, blood transfusion, exchange transfusion. You can do like, when you have low dose radiation, that can shrink the spleen size in the patient's primary myelofibrosis. So there's an option like a low dose radiation therapy. Now, what are the complications you can have in splenomegaly? You can hypersplenism, splenic crisis, where children with sickle cell disease, trapping of the blood in the spleen causing rapid anemia and shock, and mortality is like extremely high in splenic crisis, okay? Most of the children in sickle cell anemia also can have like autosplenectomy, like 5 to 7 years because of the repeated splenic infarction. And the splenic rupture following minimal trauma, when you have an enlarged spleen, so it's not recommended like, contact sport or, wear like a seat belt really tight, that can kind of rupture the spleen. Indication, what condition you have to do like a splenectomy? One is therapeutic, right? You can do like in ITP, hereditary autoimmune hemolytic anemia, symptomatic splenomegaly diagnosis, and unexplained splenomegaly on a splenic mass. All of those conditions are indications for splenectomy. Now, Pre and post splenectomy care is important. Why? Make sure you have to get the vaccinated the patient against encapsulated organism. If you're taking the test, definitely they're going to ask you about this. What kind of vaccination you need to give the post-splenectomy patient. And then pneumococcal H influenza, meningococcal and meningococcal B, and all of this vaccination, pneumococcal, H influenza, meningococcal, okay? And then antibiotic prophylaxis recommend post-splenectomy undergoing like surgical procedures. They used to give antibiotics to everyone before. Now, only if you go into surgical procedure, they recommend post-splenectomy patient presenting febrile illness. So if you have a patient admitted to the hospital or emergency room, when they have splenectomy, if they're suspecting an infection, make sure you admit the patient to a complete further workup, okay? Patient can have a medical alert bracelet also. Again, thank you so much for watching. We'll be back with another presentation soon. Thank you.